Over 1/3 of the patient population between age 20 and 40 has a tattoo today, and that number is increasing every day. Unfortunately, the number of patients that regret that decision, that's increasing as well. So we see patients every day that come in knowing that the tattoo was not the right move and desiring to have it removed. The key for tattoo removal is to tailor the treatment, tailor the laser treatment specific to the color of the tattoo or tattoos that have to be removed.
We have the ability to target different colors so that if we can maximize the treatment by using these different types of wavelengths, then we have a greater result in the ability to remove them. Tattoo removals work by employing wavelengths that break down the tattoo. And when the tattoo is broken down into smaller particles, then we have cells in our body called scavenger cells, which then are able to flush away the smaller particles of the tattoo. So with repetitive treatments, you'll see that the tattoos get lighter and lighter to the point where, they're not there anymore.
We have 3 different lasers we use for tattoo removal. 2 are in our Livingston office and 1 is in the Bridgewater office where I work. And I particularly do something called a ruby, Q-switched ruby. So it heats up the pigment and causes the tattoos to get reduced over time. Usually it can take somewhere between 4 to 10 treatments to get that. Depending on the ink that they use and the color, not all lasers work the same for all the different inks and colors. And that is why we have 3 different ones. The one we have in Livingston is called a Q-switched YAG. If someone has darker complexion skin, it's a little bit safer for them. So by having the 3 technologies, we can cover most of the colors of the tattoo ink and treat most skin types also. Beware of someone who only has 1 machine.
The only real way to remove tattoos effectively and safely is to have the ideal laser for each color of tattoo that you want removed. So ask the physicians, what's the best wavelength for black tattoo? And what's the best wavelength for green tattoo? And make sure they have all those available lasers.
I got a tattoo and decided probably after a year of having it that I did not want it. And so I got on the internet and started researching doctors to go to have it removed. I ended up going to one doctor and having a consultation with that doctor, which ultimately resulted in him making an effort to remove the tattoo with no success whatsoever. And I understand that as a black female, or just because of the pigmentation of my skin, that different lasers have to be used. And so I started to research a little bit further because I wasn't comfortable with that doctor, so I stopped going to him. So I went to another doctor. Same process again, but this one was not so much familiar with the actual process. I think what she had done was gone to a class or a seminar to learn how to do it, and she recommended Dr. Chasen. And so I ultimately ended up going to his Bridgewater office for a consultation, and then having him explain to me that the proper laser that he needed was actually at the Livingston office. And the reason why I ended up using him is because he spent a lot of time with me in the consultation. He made me very comfortable. He explained the process to me, and no one had actually taken the time to do that to me with me before. And so it was definitely a good judgment call because I was very happy with the results.